So you started out in medical school. And medical school is a journey, is it not? I mean, you're kind of finding your way. And how did you find your way into plastic surgery?
I knew even when I went into medical school that I wanted to be a surgeon. That was very important to me. If I couldn't be a surgeon, I really did not want to be a physician.
Right.
And I had a unique opportunity at a very young age to actually see a live operation when I was 9. And at that point I decided I wanted to be a surgeon, but I didn't know what kind of surgeon I wanted to be. And I didn't really decide that until I started my general surgery residency, where you're exposed to every single subspecialty of surgery you can imagine. So you're doing orthopedic surgery, urology, delivering babies, and I got exposed to a plastic surgical procedure, and I realized I understand this.
Right.
I don't even have to see it twice.
It was almost like second nature to you, am I right?
It does.
Yes?
It does. I think the profession draws you in that direction,
right,
and you find where your comfort level is.
That's interesting. That's interesting. So getting into the plastic surgery field, you know, it has to be fascinating, first of all, and it's changing. Is it changing for the better, in your opinion?
What's interesting about plastic surgery is it tends to go in cycles or circles. You know, we start off with what I learned 20 years ago in residency, and then you see all these changes that occur.
Right.
New technology, new approaches, and then you realize almost everything comes back full cycle to where it was before.
Right.
And you learn that the fundamentals of plastic surgery are the most important aspect of practicing plastic surgery.
That's interesting. Now, it's interesting because I have done research on you, and you have an excellent reputation for practicing those fundamentals and that ethics there. So, in your opinion, is there things that people out there who are watching this that they need to, you know, there's two things that I find that people are looking for. First of all, they're looking for a surgeon that's competent, which you are. They're also looking for somebody who's kind and compassionate and really cares about them. So back to the competence issue. Are there things that people out there should be looking for in a surgeon?
Absolutely. I think that you need to do your research. You need to ask your physicians, if you have an internist, an obstetrician, gynecologist, try to get some names. And once you get a few names, these days it's very easy to Google and look up someone's credentials.
Yes.
It's very easy to access the sites of the American Board of Plastic Surgery and make sure that your surgeon is board certified by the American Board of Plastic Surgery, because I think what's most confusing to people and patients when they're researching their physicians is that any doctor can call themselves a cosmetic surgeon.
Is that right? Now that's something that I didn't know, and I had questions because I've seen doctors I have known that I didn't know they were cosmetic. So go on.
You could be any type of physician, call yourself a cosmetic surgeon, and you can perform cosmetic surgery and cosmetic procedures without any formal training.
Okay.
And so there are these boards that are really not recognized by the American Board of Medical Specialties, which is what our viewers really need to understand, is that just because someone says they're board certified does not mean that it's a recognized board, nor does it mean that they're board certified by the American Board of Plastic Surgery.
May I ask your certifications? I've seen a bunch of letters after your name, so for our viewers.
Yeah, my most important certification is the American Board of Plastic Surgery. That's really the only board that recognizes the plastic surgery field. There are other boards that recognize just limited facial plastic surgery. But as a board certified plastic surgeon, we are board certified to operate anywhere on the body.
That's interesting. Okay, so the competence issue we talked about. How about how important is that kindness and that compassion component of practicing? I know my viewpoint because my patients, a lot of them that came, you know, that were regular, that came back to me, it was because of the kindness. They knew that people cared, and you have a reputation, honestly, in the community for caring. How important is that?
It's very important. I actually enjoy interacting with my patients and learning about them as much as I do operating on them. So I take an interest in my patients. I find it fascinating to find out what profession they were in, what they did, where they went to school, where they grew up. Sort of like what we're doing here. You're trying to find out a little more about me. I enjoy finding out about my patients because it creates that rapport and that interaction that makes their experience with me so much better.
Oh, it has to.